America's obesity epidemic is growing as fast as our waistlines. A new study finds the obesity rate jumped to 27.7% last year. And for those of us living right here in the Midwest and in the South, we are getting fatter even faster.
Let's bring in Chief Health Editor Dr. Partha Nandi to talk about this. And Dr., why us? Why the Midwest? Is it our weather?
I know it seems like, we get hit with everything, right?
Okay.
Weather is part of the story because Minnesota, for those of you watching, Minnesota has an obesity rate less than 26%, and they keep it that way. So we think it's more than just that. So the availability of cheap processed foods and where they're located, number one. Number two is how your neighborhoods are located, what your public transportation is like, and also the income level. The Midwest and the South has some of the most poorest areas in the country. So that counts. In Minnesota, what they've done is they give grants now for recreational trails as well as farmers markets. So the bottom line is that, eat well, move a little bit more, and you can fight obesity no matter where you're at.
It's expensive to eat healthy, but so many diets these days seem to be wrapped around protein. Is that a good thing?
That's a big story. So there's all these fats. The whole idea behind diet, I hate the word diet, because when you say diet, what happens is that people fail. How many diets work? There's so many fad diets. Today, making big news, health officials are calling for changes to the food pyramid. They want Americans to eat less meat and more vegetables. The reason for the shift towards a more plant-based diet. 3 of the 4 leading causes of preventable health, heart disease, cancer, and stroke, are related to what we eat. Heavy meat consumption, especially red and processed meats, increase your risk of dying from those diseases. Eating more vegetables decreases the risk of all 3. And on top of that, saving your life, a plant-based diet also saves you money. Those kinds of chronic diseases account for 75% of all healthcare costs. So, the thing is that have a balanced diet. You should have some carbs, some protein as well as fat. And if you combine all of them in a balanced portion, you'll do well. For my family, we have a plant-based diet, less red meat. Memorial Day, you got to have a hamburger? Absolutely. But just don't do it every day.
So they're changing the food pyramid, actually, to say, hey, eat less meat, more vegetables.
That's exactly right.
Yeah.
And one of the things people tell me is that, Doc, I work out, I need more protein, man. You can't give me that. So what I tell them is that plant-based protein is really important. If you have legumes and beans and soy, use those.
Instead of meat.
That's exactly right. So you don't have to skimp on anything. Just have a nice balanced diet.
Yes.
Go towards plant-based. Don't go crazy. If you need to eat red meat once in a while, it's okay. Just not every day.
And what about turkey and chicken?
It's good. Turkey and chicken is good, but I would still say if you can do that 4 times a month and do more fish, it'd be great.
All right, doctor, thank you so much.
Thank you.
If you have a question for Dr. Nandi, we'll get you to the good doctor. His email address, drnandi@wxyz.com, or send it to us on Facebook and Twitter.